I do want to talk about the folks who say they were never getting the vaccine. I have some family members who are, and I have some friends who also, talk negatively about vaccine for many reasons. I think it is totally fair that folks who feel like this process happened really quickly, they've seen some reaction, they want to wait just from a tolerability perspective. I can understand that. But there are folks out there who have a level of distrust in the system such that the whole idea of being used as quote unquote guinea pigs. And there's a cultural and history behind that feeling. But as a clinical researcher, I want to at least take some time to address some of that. For one, yes, the Tuskegee Project is the one that we think about first. And actually, part of that Tuskegee Project, some of that actually happened in Central America too, and Nicaragua, I think. But what happened there was folks of color were infected with syphilis and not given appropriate medical attention just to see what would be the long-term outcome, and a lot of people lost their life. That's a really, really bad time in our history. But what came out of that was in the 1970s, there are a number of laws, regulation, both nationally and internationally, that was put into effect to protect patients on clinical trial. I will tell you, one of the more difficult things I do is to be nonchalant about trials, to make things up. You have every box need to be ticked, every I need to be dotted before I can put a patient on trial. So, for example, we are guided by the principle that I cannot offer you a trial that you didn't voluntarily make the decision to go on, meaning I have to provide you with information on the trial. You go home, you read it, you discuss it, and then make a decision that you want to do. The second part of it is anytime during that trial, if you come on a clinical trial, anytime you say for any reason, I don't want to do this anymore, you're off the trial. No ifs, ands, or buts. All right? Yes. Another part is there's a group, and I'm part of the IRB, which is the Investigational Review Board, where every trial has to be judged based on sort of a benefit/risk ratio. Every trial has to have a potential benefit in order to be offered to a patient. And there is a group called an IRB made up of professionals, lay people, investigators who sit down and review every trial that's being offered to patients and continue to review those actively as they are going through and make sure that this is safe for patients. And only then can a patient go on the trial. So there are lots and lots of protections. Are there people out there going crazy and trying to buck those? Probably, but that's very, very rare, and they all get caught.
To add to Greg's point, just Tuesday gone, I submitted an IRB request for a research project where my subjects are actually medical students. In my research project, they're actually going to be doing an exam. I'm not giving them any medication, any injection or anything. But I still had to go through that same rigorous process that Greg is talking about before I get approval. And I'm not introducing anything new to the subjects. So it's not as simple everybody just doing what they want thing. This thing, to get this drug to market, to proceed with these research projects, the researchers have to go through a very rigorous and screening process before they get approval to do what they want to do.
I mean,
And importantly,
one could argue and say, well, you do have those who are unethical and who would probably try to, you know, as you say, cut corners and or take shortcuts and may have
but
money.
that's why
Yeah.
that's why the decision is not up to the physician or the researcher.
Right.
There are groups that are independent of the researcher who review those things. Importantly, pharmaceutical companies themselves who own the drugs and sponsor the drugs, they themselves cannot conduct the trials.
Yeah.
That's why there are people like me. They have the drug, they sponsor it, but only physicians independent of the pharmaceutical companies can conduct the trial. I do want to make also mention about folks of color and clinical trials, not just COVID. The fact remains, especially in oncology clinical trial, in the United States, despite being maybe 15 to 20% of the population of the United States, only about 5% of folks of color participate in clinical trials. All right?
With
You may
reason.
say, some
Yeah.
people may say good, but here's the issue.
Mm-hmm.
Right?
The
The
benefit.
issue is when the drugs get approved,
Yeah.
guess who uses it? All right. When diabetes is one of the
Yeah.
diseases that affect the folks of color the most,
Oh, yeah.
all right, you are going to use the drug when you don't participate in the trial. What we don't know is it effective in you, in
Right.
people like you? Is it more toxic in people like you?
Yeah.
Are there any other adverse risks? We don't know that, but you end up using the drug. All right. So that's what's happening. We have people who don't participate in the trial, but still end up using the drug and expect to get very similar efficacy. We hope that they get similar efficacy. Right now, there's a big push to sort of increase sort of minority population in trials because we do understand people are different, and we do understand you can see difference in efficacy, difference in tolerability and toxicity on trials. And so it's really not a good thing that folks of color don't participate.
It's going to take it sounds like a mountain to climb to actually convince people of color to get involved in trials because, as you said, of the trust factor and the historical reasons for that. Of course, there are genuine reasons why people would be very skeptical about it. We've heard of the conspiracy, they call them the conspiracy theorists out there who talk about people wanting to get into your DNA so they give you that vaccine to control you, to control the brain of the black man, of the black people, and all sorts of things that surrounding this COVID-19 virus and the vaccine. So I'm happy that you guys are helping to debunk some of that tonight, really.
So that is really a problem, and you would imagine that we as physicians, we get phone calls from our friends all the time and colleagues about that.
Yeah.
Just maybe 2 weeks ago, I had a call from a friend of mine, from Colliho, who told me, you know what, he's headed to Home Depot right now because he understands that the 5G is in the virus.
Here we go.
So he's going to Home Depot. He said the virus is not a problem, it's the 5G. So he's going to Home Depot to get a mask that has a copper filter in there to keep the 5G out. And I'm trying my best to educate him, to explain to him that this cannot be possible, but it's a mountain to climb. And you imagine we have people call us with that issue in the morning, another one calls us at midday. So we spend a lot of time, trying to educate people and to get rid of the ignorance around the virus and the vaccine. But it's really a mountain we're trying to climb. It's really a challenge.
Yeah.
But
and you can't really blame people because a lot of people don't really know the field enough to discern what is
exactly
real and true from what is not. And you read all of this stuff on social media, and it's hard. And some people are just that way. To believe those
They're
those
prone.
stories. And it's hard to break through once you've gotten that in your head. For some reason, Bill Gates is a villain.
Yeah,
Yeah,
I don't understand that.
yeah.
I
I
don't.
had a discussion with my brother, with one of my brothers, on my dad's side. And
Yes.
what Bill Gates is trying to do is really something that's going to benefit our people. The interest in malaria, for example, nobody has come up with a vaccine for malaria, and that is what is killing a number of our sub-Saharan African, I'm colleagues back there in Africa. So it's really disheartening to see people attack Bill and Melinda Gates when they put in so much of their time and resources into something that's only going to benefit us.
The
So
guy has spent all of his billions of dollars. Nobody else has done that.
Yeah,
And put it in a foundation that is spent mainly trying to in the African continent.
yeah.
Um, and I don't understand where those things that's coming from.
I
It's about.
mean,
I heard they're trying to control the black folks. I
yeah.
don't know.
That's the same kind of pushback Bill Clinton got in sub-Saharan Africa when he was trying to eradicate the Guinea worm, which was really causing significant morbidity in that population there. And it was a simple issue of just boiling the water, and there's, so much pushback on that.
so
But
it
the
is
other
clear that,
problem I want to bring up
yeah.
before we move on is the fact that we have medical professionals
Hmm.
who are propagating. I saw a doctor in Dominica
Yeah.
with a post on Facebook describing how people are going to mutate after they take the vaccine, and that is disheartening. Somebody in
Wow.
the medical field who spent years in medical school, who understands those things, propagating that kind of ignorance, and people look up to people like that. You're a
Yeah.
physician in the community. People
Hmm.
people look up to you. What you say is gold. You have to be a little more responsible with what what you put out there and what you feed the people. You have that responsibility to the people. I saw a video recently of a Caribbean physician who is talking about the fact that an RNA virus, COVID is an RNA virus. It's not a DNA virus like hepatitis B. He is stating that the RNA viruses are so labile that a vaccine will never work for a virus like that.
I
Now
saw
that
that
just
post.
took me back.
That was a Jamaican guy.
Yeah, that took me straight back to my training at Boston Children's Hospital. Because at Boston Children's, there is a basement down there where they have 5 iron lungs that are now obsolete. We don't need those iron lungs anymore. Why? Because of the polio vaccine. Those were used to take care of polio patients who had respiratory compromise because of the effects of polio on the nervous system. Now
Hmm.
we don't need those anymore in the US because the polio vaccine, and polio is an enterovirus, so it's an RNA virus, has eradicated polio pretty much in the US. The same for measles. Measles is an RNA virus. Mumps as well. So I don't know how ignorant a physician can get to make a whole video dedicated to trying to debunk an RNA virus and its effectiveness. This
So,
is what kills me.
so right now you're saying that there is need for a greater level of discourse, not even just among
Yes,
the regular lay people like me, but even the medical
healthcare
professionals
provider.
throughout the world. Because one of the
Yeah,
things that is in my mind, and I'm wondering, and I'm guessing that some of that is already happening, but I'm hoping and I'm wondering whether there will be or there is some level of unity or unism in developing that very vaccine. Since we have all these different types all over the world, people are coming up with different, even in the US, as you said, you have Pfizer, you have Moderna, you have Johnson and Johnson developing its own, etc. I mean, the communication, the need for that level of dialogue and sharing of data in terms of the impact of the vaccine as time goes by, so that there can be a better tweaking. As someone asked the question earlier, like, will there be continuous tweaking to make the vaccine safer? I want to think it's a yes to that, but you guys
I,
can speak to that.
so the answer to that is yes. what happens and what continues to happen in the medical field and the scientific field is um, we do have large conferences and folks present their data over and
Right.
over and over. They're showing the reason the vaccine was able to be created so quickly. It's because once in China, once they got the sequence of the virus, they made that available, and very quickly folks were able to start. That's why the Moderna vaccine, you hear about this black girl in the NIH who was working on that. The reason they were able to start creating that very early, it's because they were starting to create a virus for Ebola very similarly. And once they got the sequence that was made known and put out there by researchers who had it before, they were able to then use that knowledge that they had from creating an Ebola virus Ebola vaccine, to then target making a COVID vaccine. And so we could get there faster than we've ever had.
So you would remember, sees that I mentioned the VSafe app, right? So one of the things they're using that for is to collect data. And that data is not just going to sit there. They're going to analyze that data and try to see if they can determine, whether or not they're seeing certain patterns in there, in the response, that the individuals are giving. And that is going to serve to help them determine, how better that product can be. What can they do to further develop? They don't just stop there. Now that we're getting the vaccine, Pfizer and Moderna are not just sitting back with their hands crossed.
Right.
They're monitoring stuff, they're studying the data, they're doing further research.
That is good. That is very important. That is very, and I'm happy to note, the usage of technology even to get that data rather quickly. I can imagine how rapidly you're getting that data. They're getting that data, because if people sign up to this app and quickly start sharing what is happening to them, how it's impacting them, etc. I can imagine how quickly the tweaking and the enhancement of those particular vaccines can happen. So I think there is a level of hope when I hear that.
So the one thing I want
importantly
to add,
though, too. Sorry, importantly to a lot of those companies like Pfizer, for example, has vouched really to create this not to make profit. So they're selling those or giving away those vaccine really at cost. They go to the government and they say, this is how much it's cost me to make it. The government buy those vaccines. A lot of them are not in it for profits. I don't know about the smaller companies, but the larger ones who started with the vaccine, that's not a profit making, at least not through the vaccine.
So the other thing I'd like to add though is, we want to give the praise to Pfizer and Moderna and those companies, the biomedical companies that produce the vaccine. We need not forget all the other companies that are involved with logistics and Amazon, the Palantir, those companies that bring the vaccines to your doorsteps and make it work in an efficient manner. Have the trucks coordinated, to get to California from Michigan, to get to Florida from Ohio. And so it's not just those vaccine producing companies, it takes a system of different industries to really get the vaccines, to the individuals who need it. And, the airlines and, all those, different areas within the economy that makes this happen. The information, sharing and that kind of thing. It's really a big deal.
Commendations to all the players in the field, all the people who make this possible, and we're hoping that the distribution can increase as soon as possible, because I have been following the news, and according to CNN, there was not so much of a plan for distribution left for the new president. So
well, I'm not surprised.
Yeah. It's important that happens rather quickly, so it can reach the people who need it most. Just to take a few questions.
We have to thank our volunteers too. Those who took the risk to volunteer for those trials.
Yes.
The thousands of people.
Yes. I was very happy to see the person who received the vaccine, the first person was a black woman, call it.
Yeah.
I think her name is Sandra. She's a nurse.
Yes.
Or
Yes.
Sandra, something like
Tracy,
this.
I think. Yeah.
Yes, and I was very happy to see her. Days after she received it, she was featured on that in that. I think it was a concert that was held the night of the inauguration. She was one of the
Oh, really?
persons who
Okay.
were featured. Yeah. So I felt like that was a bit of encouragement for people out there. You know, she took it, and hey, she's alive. Look at her; she looks well. You know, so I'm hoping that that is also a sense of encouragement for people like me and the rest of us out there who are still thinking about whether we're going to accept yes, no, you know, to take the vaccine. Yeah.
So one of my rationales behind, you know, whether or not I should take that vaccine is the data.
Yes.
When I look out there and I see that 3% of people are dying from COVID, and I see people looking like me, my age, you know, my race, my sex, who are dying from COVID, when I see that it reached, you know, close to home where somebody from Coliho who's not that much older than I am died from COVID, and I look at the risk of taking the vaccine at the time, it was, you know, Bell's palsy was one of the most serious side effects of the vaccine. Even so, that was temporary. You know, it was a transient thing. It wasn't permanent at all. And even with that, I could see myself living with Bell's palsy for the rest of my life. However,
And Bell's
people like
palsy is where one side of your face,
one side of your face just droops, you know?
Yeah, yes.
And, you know, it makes all the sense in the world that I get vaccinated.
Mm-hmm.
You know what I mean? So many people are dying out there. We at 400 and something thousand in California. You know?
Yeah.
So,
and so importantly too, on the Pfizer, at least the Pfizer study, remember I talked about only 5% of folks of color participated in trial. Actually, on the Pfizer study, 40% of the people who participated on that trial were of color, be it Hispanic and or Black.
American.
Yeah. So we have a lot of very good data to suggest that it's effective and safe.
That's good.
In folks that look like me and you.
So and that goes back to Greg's previous point about Black people enrolling in those trials. We need to remember that if we as Black people don't give ourselves an opportunity to participate in research, we're never going to know if that drug in question is effective in all people or if it produces significant side effects in all people. So it's really important that we really are part of those trials. Otherwise, we just don't know.
Someone says every 20 seconds, one person dies from COVID. I saw one, I think I was watching the news, CNN, and they said every 6 minutes, somebody dies in Los Angeles. That was probably a few days ago from COVID.
Well, to be honest with you, a few months ago, one of the senior hepatologists here at the hospital, on a Tuesday or so, he poked his head into my office and said, "Oh man, you have a nice office, I'm jealous." And on Sunday, I get an email from the hospital and the man is dead.
Oh my gosh.
Yeah.
From COVID.
From COVID. So, I mean, that got me thinking. I mean, it's
serious. Yeah.
It's out of this world type of experience here. A man I've been for my 6 years here.
Yeah.
You know, vibrant, active, and just like that, he's gone. See him on a Tuesday and on a Sunday, he's gone.
Yeah.
So it's really dramatic.
There are people around you that you see, and that's the thing. I mean, we are here, we have very few cases, although one is too much for us, you know, small population. But in comparison to even some of our sister islands, we are still really low within the numbers. But we think about people like you all out there in the heart of the thing. I mean, my own sister was diagnosed with COVID. And thankfully they've been able to recover. So, I mean, there are people that we know, people that we see, we've touched before, and now we're hearing, and you guys know a lot of them. So to hear you, to share those stories and to say to us, look, I took the vaccine and it's important that you take the vaccine. is very encouraging and enlightening to me personally, and I hope to all the folks out there listening. I see Sharon Liquent, Sharon Dupin Liquent is on. She's saying, hi, Nick, this is very informative. She says we'll be opening our public vaccine clinic next week. She's somewhere in the US as well. But I know that this week or last week she received the vaccine. I think I saw.
Yeah, I saw that picture.
Yeah. So it's good. Yeah. Go ahead.
One of the things I wanted to say is we've seen, looking through the media, that leadership matters. We see how in the US and other parts of larger countries in the world, the difference in infection rate based on leadership. You know, in Dominica, again, not trying to make this political, but Dominica has fared very, very well. And part of it is due in part to your leaders taking this seriously and doing what they needed to do to protect the country. You have to give kudos to folks when they've done something well. And folks have been very lucky in Dominica because, yes, your leaders have done very well.
Yeah, I think our healthcare professionals as well. You know, I'm on a little chat with the group, and it has been a very positive dialogue on there where, you know, members of the medical board and the medical association and the physicians association, they tend to share information and really work with each other in enlightening the other healthcare professionals around COVID and the measures and the new approaches that have come up and what we do next and what we do in that situation. I must give them a lot of credit for what they have done in Dominica and what they've been able to accomplish. We haven't had a death, and we've had a few cases, but we've done pretty well compared to a lot of these first world countries out there, where I think we've outdone them, with respects of handling, COVID-19 and quarantine and prevention, and those very, very good measures.
Just to tell folks who may be wondering what are the figures we're referring to, as of Monday, January 18th, 2021, January 18th, that was, we had nine total active cases. We had 0 total COVID-related deaths. Total recovered 104. Total confirmed COVID-19 cases 113. Number of contacts under investigation at that time was 0. Number in government COVID-19 quarantine was 51. Number of contacts cleared was 868. Number of contacts identified, 868. Number of persons tested was 8,498. And number of negative results was 8,385. And that was as of 18th of January this year. We're talking about just a few days ago. Yes. So
I mean, do you remember that first case that came to Dominica where that gentleman went? I can't remember what village it was.
In the eastern
and you had about 7 or 9. You had 7 or 9 cases related to just that one person.
Just one.
Imagine if that wasn't managed appropriately.
Yes.
How quickly that could have spread through the country. Imagine if 10 people needed to get intubated in Dominica, Nick.
Yeah.
I mean, do we even have 10 ventilators?
That would have been a disaster.
It would be a disaster.
Yeah. And that is why the health authorities are constantly reminding us here to not take things for granted, to remain vigilant. And also discouraging the people who try to come in by back door. They put us at risk. They put their families and loved ones at risk. And so asking us to be vigilant, respect the authorities. If you want to come in, save your money, come in the legal way, go through the quarantine so we can all be safe together. And I know that there's a possibility that folks are getting tired of wearing the masks. When you go to this, to that, you have to put it on, sanitize and being so cautious. But in reality, it becomes the norm. It's now the norm, as I said, the new normal. And so we have to stay on it. We have to keep at it because we can see the results. We can see the results. How our authorities, our leaders the health, the Ministry of Health, the minister, and the entire, all the essential workers. Have these people not done their part to, to pull things in order as quickly as possible, we would have been in trouble. And so we have to truly thank them, commend them, and continue, Dominicans, continue to do the necessary things to keep Dominica and the rest of the region, for that matter, safe and COVID-free as much as possible, so we can help the rest of the world. Yeah.
So one of the things I would like to see come out of this, COVID-19, one of the things that has happened is that a lot of us out there in the diaspora have been able to collaborate and work with the physicians in Dominica, share information and that kind of thing. And what I'd like to see though in the post-COVID era is more collaboration between our healthcare profession. And it's a thing my good friend Shay Avril always brings up, is that we're not working with the resources we have out there. We have a lot of professionals out there, whether it's healthcare, engineering, agriculture. If we could form a little network whereby we can consult with each other. I mean, Greg knows that I call him all the time when I have cases around oncology and I need some advice as to what sort of medication we should be thinking about. If we could do that on a larger scale, involving the healthcare system back home, maybe even with a few of us dedicating a week of our time to going back home, to work with our physicians in the hospital, depending on our various expertise, that to me would be a very productive and very, 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 very good initiative.
Well, I'm happy to hear that. I'm happy to hear that.
So
and
Nick,
we can start from here. We can start from here. I think. I'm happy to hear that you guys liaise. I know that you are in very close contact with Dr. Wallace as well, Mervyn Wallace. We also have another Wallace, Nadia Wallace, who is a psychologist. So we have lots of doctors, not just
Nadia and I exchanged text yesterday.
That's right. Yeah. We have Jovid over there in Trinidad. Yes, and all these people.
That's where he is.
Yeah.
So Nick, I sent an email to you. We talked about this.
Yeah, I saw
There is an initiative that's being at least being thought of currently in Dominica, because I got an email from at least the health board, a member of the health board, about collecting names of Dominica's physicians, their specialty and their contact.
Yeah.
To create and do that very thing. And so as a result, because we have open ear, and I would like you to help me with that, anybody who knows Dominican-born physicians out there, can you send me their names, contacts, and specialties?
Right. So I'll do that.
That list together. So even Momoy and anybody else who's on there,
send
my
it to
email
me.
address.
I will send the information, all to Greg, to Nick, and they will get it to the necessary authorities. I mean, you guys know that a new hospital is being the hospital is being almost, well, I don't want to say new, but it's new. It's being turned into new. As a matter of fact, I mean, new name, new parts, new. If you see what has already been laid down, it's beyond what we would envision for a quote-unquote little island, right?
Yeah.
And of course, we have a number of new health centers being built throughout the island right now, and of course, the new Margaret Hospital. And so all these are going to require, as you all say, the specialties of the various various health aspects of humanity. And so people like you all in your different special areas or specialties will definitely need to, if not come home, but at least to lend the support and the guidance. What is going to be needed and so on. So I think maybe that's where that is coming from, Greg, when they're asking for those kinds of data. So I'm happy to know that they're reaching out already.
So definitely, that's the whole idea.
Yeah, that's something I'm very passionate about. I want us to give back, and I'm pretty sure there are thousands of professionals out there in the diaspora who would love to give back to their community in a meaningful way. Yeah. And at one point in my career, I was the person responsible for I'm reviewing and diagnosing a lot of the malignancies that were coming from children in Latin America, Guatemala, Costa Rica. And one of the reasons why those would come to me is because I was the only Spanish speaking, junior person in my department at the time. It was very good for me in terms of learning and getting the experience, but also I was doing a service for people out there that I could have also been doing for my people back home. You know what I mean? So I think it would be a good idea to really tighten the relationship between our physicians at home, our healthcare system at home, and our physicians out there. And I know
Yeah.
a lot of physicians in the US, in the UK, New Zealand, Australia would be very happy to give back to our people.
Right. I
Yeah.
see Good Living is already extending some names like Swinburne Augustine. I think that's the name that he's extending there.
Somebody in Florida.
Right. He said we should contact you guys should contact this gentleman. He's in depth on the level of COVID. I suppose he has information. And so all of you out there, our listeners, thank you all so much for staying with us. I know it's late and some of you are still here. It's a Friday night. So I really want to thank you all and commend you all. But I also want to ask you to share that information that Dr. Shillingford and Dr. Vidal are sharing with us tonight, that they are trying to see how they can create and contribute towards the creation of a network of health professionals throughout the world, throughout wherever they are, and they're Dominicans, that there is that link. If you can't get to them directly, you can send the information to me. I will forward it to them so that they can create and help to create a database. It's going to benefit all of us in the long run. So we're very happy that some of you are already sharing that information. If you have those information like Good Living, if you have his contact information, share that with us. We can send it to Greg and Nick as well. All right, gentlemen, doctors, my friends, I am so happy that you all could share so much with us. But obviously, this is not exhausted. We cannot exhaust this subject that we're discussing tonight. There is so much more that can be said, that needs to be said, but I think that you have set a very solid foundation for a lot of the skeptics out there, and now you've given us reasons to go out and research more. But before you give your closing remarks, each of you, I would want to ask you, or maybe in your closing remark you can include it, where would you encourage lay people like us to get the genuine health information that we should take at face value when we read it? Because there are all sorts of sources out there. Clearly, anybody can sit on the computer, create a Wikipedia page or whatever, and just put out stuff. So, in your closing remarks, I would want for you to share that as well. Any one of you can go first.
You want me? I'll go first.
Yeah, go ahead.
So, again, Moy, thank you for. I keep calling you Moy because that's.
Hey, that's fine. That's fine. Listen, the people who call me Moy, it means so much to me because I know that these people know me from way back when, and so it says a lot. So there is no harm in it. I am good with Moy.
All right, cool. So again, really, really thank you for having this conversation. I think this conversation was really needed. I hope a lot of people get to see it and to tell their friends about it. I hope we also address a lot of your questions, although we hadn't taken very much questions, but I think in our conversation, we may address a lot of the things that you questions that you've had. Importantly, I think what I want you to take away from this is COVID is very serious. It is deadly. It may not be deadly to the average person, but people who are most at risk are dying from this disease, and it is not going to just go away. We can't just wish it away. We have to take particular action, both in our personal life and our health life. Social distancing, masking is important. It prevents the spread of the disease. Vaccination, again, vaccination is preventative.
Yeah.
If we can vaccinate enough of our population, we can potentially eradicate this. All right. There are obvious concerns about the rapid pace of these coming in to use, and I understand that. I hope by having two physicians who themselves have had the vaccine and have done well, who know enough about it and still decide to take it, will let you feel a little bit more comfortable that this is safe. As far as getting where you can get information on, um, there really isn't one particular site that has all of the information, but in general, information that you get about COVID from sites like CNN, the New York Times does a lot of very good write-up on COVID. I would say your source of information, make sure you are familiar with when you read an excerpt on Facebook or on social media, that the source is someone that you recognize and you can trust. And if you don't recognize it or trust it, it's very easy. Google them. All right. And then you can figure out for yourself and then do your own research. If they say something that is a little bit against or out of what you believe, do a little bit more research about it before you accept it. And again, Moy, really, really thank you. I will give my email address. It's gregoryAvidal@gmail.com. I am really interested in collecting the names of medical professionals, their contact, and their of Dominican origin, their contact and specialties. Again, it's gregoryAvidal@gmail.com, so that we can, as Nick was talking about, put those together to create that database that we so need. Thank you.
So Momoy, I'd like to thank you for having me on here. It's always nice to be able to connect with, the community that created us, really, the community that grew us, that raised us.
Indeed.
And give back, in terms of, imparting knowledge, imparting guidance, sharing, with our community. It's always a pleasure to do that. That is what we're about.
Yeah.
I want to encourage the listeners to at least put a little thought into, the vaccine and COVID virus itself, compare the implications of either of them, look at the worst case scenario, the worst outcome you envision with COVID-19 and the worst outcome you envision with the COVID vaccine. Take a look at the rate of adverse or bad effects secondary to COVID and compare that rate to what you see and hear about and read about with the COVID vaccine, and determine for yourself whether it makes any sense at all to risk getting COVID against getting the vaccine to protect yourself against COVID. And when you do that in-depth analysis, you will realize that it does make some sense to at least consider the possibility of being vaccinated, especially for those people out there who have pre-morbid conditions, things like diabetes, hypertension, lung disease, immunocompromised states, people who are on cancer chemotherapy. Really give it some sort of consideration so that when it comes around, you can make an informed decision as to whether or not you think that this is something that is good for you. I do believe that it is. The other thing I would like to encourage you to do is, when you go out there to seek information or when information comes your way, ask yourself if you think that that person who is relaying the information is qualified enough, has enough experience, knows what he's talking about, enough to influence you to decide whether or not you want to take the vaccine or you want to go face COVID-19 on your own. I mean, when I go back to Dr. Fauci, I remember the Harrison's Internal Medicine book, which is one of the Bibles of medicine. Anybody who goes through medicine anywhere in the world, in any language, has a copy or has had a copy of the Harrison's. And Dr. Fauci is one of the principal authors of that book. You'll see his name on the cover. So that's not a man who's just popped out of nowhere. That's a man who has vast experience in the medical field. He understands viruses. He understands virology. and it's somebody I think we should trust. He's the expert. You know, why should we trust a man from Jamaica who claims to be a bush doctor, a bush physician, who tells us that the vaccine is not good over somebody like Fauci who has experience with viruses and vaccines? So our source of information is important. And you know, we have to give that serious consideration when we make those life-changing decisions, because they are really life-changing. You know, parents are dying and kids are becoming orphans. You know, we're losing our siblings. We're losing our doctors, our nurses in the community. So these are really serious and life-changing implications with this COVID-19. So put the thought into it, approach it from a critical thinking point of view, and ask yourself whether or not it makes sense to not vaccinate and risk getting the vaccine, especially if you have a pre-morbid condition. So that's what I'd like to leave with our audience. I'm not telling you what to do.
Yes.
I'm asking you to give it some consideration, give it some thought, and
Mhm.
do some research for yourself if you're not satisfied with what you know. Dig into it, go to the CDC website, read up on it. It's all there for you. And, you know, inform yourself. Knowledge is power
Yeah.
at the end of the day.
Yeah.
Knowledge is power.
Oh, so yeah, so the CDC website, that's definitely a place that you can go in to get information.
Yes,
Agreed.
I was actually going to share that because I have to do my own reading prior to meeting with you guys tonight. And of course, that was one of the places that I went and got some very solid information about the various types of vaccines out there. So I want to thank you all on behalf of all the viewers, all the people who have joined us tonight on YouTube and on Facebook. I truly want to thank you and all of you gentlemen just for making yourselves available in your busy schedules. I mean, Nick is still at work, as he said earlier, and I know Greg always has something else that he has to do. He's always busy, even if you feel he's in a t-shirt, but I'm sure he's doing some good stuff in any case. So I want to thank you all for making it your business to share with your people, our people. You know, I'm happy to tell you that a number of people on the chat have said they were on the fence before they came, but they're no longer on the fence after this discussion. I think if we have at least if we've educated at least one person, then we have done something good, because they will go back and tell somebody else. And thankfully, this video is going to be on for as long as possible, as long as it's going to be on YouTube and Facebook, so folks can go back and view it again and get some of their questions answered, and maybe reach out to you all. I mean, Dr. Gregory gave his address. I put it there in the chat. It's gregoryvidal@gmail.com. So you guys go ahead and send him an email if you have a question. And I'm sure Dr. Nick is a bit private. Of course, he used to be on Facebook.
I can share my email. That's fine.
All
So
right.
I can be reached at
No pressure.
Shillingford9@gmail.com.
Can you tell us again? Sorry.
It's my first name followed immediately by my last name.
Okay, good.
9
Yes.
@gmail.com.
Awesome. So it's nickshillingford9@gmail.com, guys. It's easy. So you now have good contact of our dear doctors, and we can all reach out to them. Take advantage. Don't abuse them, but I mean take advantage in terms of getting the proper information and references that you might possibly need.